Hi, I'm Dr. Mike Milligan. I've got a real treat for you now. We're here with Fred Joyal of 1-800-DENTIST. Fred, thank you so much for being with us.
Nice to be here, Mike.
Great. Okay, we're here at the California Dental Society meeting, so there is a lot of commotion, a lot of noise going on, but you really need to hear this. Everybody knows 1-800-DENTIST and they know about Fred. Fred, why don't you tell us how you got started, a little bit about the company, and where we're going now and how it's growing and all.
Well, we started back in 1986 with 18 dentists just in LA. We had a little 200 square foot office where the phone rang, and we ran some radio ads, and we got 50 calls the first day, you know, just helping people to find a dentist. So we knew we were onto something.
Yeah.
So gradually we added dentists and went on television, and that was really blew the whole thing up. And it's become a nationwide program now. 24-hour live call center, 365 days a year, processing 100,000 referrals a month.
Wow.
With this massive database, all the dentists on the program are screened, and we have all the information about them, where they went to school, all the special training they have, all the services, all the associates, everything that's possible about the practice is right there in the database. And you know, we're expanding now. There's probably 10 different websites that all feed through the system, but our goal is to make it as easy as possible for a dentist to get new referrals without having to do anything, because advertising is challenging, you know, and so we try to give them a consistent flow of new referrals without having to think about how it's done.
Great, great. Now you're doing ads on the internet to get patients. You're in the phone books, in many phone books. You're on radio, TV.
We use whatever medium works, and we're the ones that are testing and tracking. So we'll use all sorts of network. We're all sorts of cable TV. We'll use some radio. We use all sorts of websites. We buy 1 million keywords on Google. I mean, we're
incredible.
Yeah, it's an amazing thing to manage, and it's, you know, the internet is this ever-moving target. You know, now there's all the social media that a dentist has to figure out how to handle, and whether it's worthwhile. Most of the time, it's a waste of time. So.
Okay, wow. So you've been doing this since 1986. You've been growing and growing. How many dentists do you have using?
About 2,500 dentists on the program right now.
2,500. Are areas exclusive, or how do we become involved with it?
The program is based on consumer response. So when we reach a plateau of response, that's where we cap the membership. So it's not territory based, because it's much more about making a satisfying experience for the consumer to find one of several dentists that may meet their specific needs. And also giving a consistent number of referrals every month to the dentist, and particularly every year. So
that's a lot of the way it works, as long as they're getting that consistent number of referrals. But you know, the other thing that you do is you screen the patient calls so that the dentist isn't getting flooded with a bunch of garbage calls.
Right. I mean, that's the problem. There's so many calls that come straight at the practice from all their other advertising. We stop and we filter them out. So, you know, if it's an HMO call or an other insurance plan they don't have, we're screening that out. Or if it's somebody who's broke and just looking for free dentistry, we're going to save them that time. Or just has a random question, we'll answer it about dentistry. You know, we don't clutter up their phone lines with non-referral time. So, but when we pass off this referral, this is somebody who really should be going to the practice.
Fantastic. And now you've got a book, Everything is Marketing.
Yes.
You came out with this last April?
Yes.
So you're just an expert on dental marketing.
Well, it's based on the concept that every aspect of the practice either increases production or decreases production based on what you say, what you show, what you do. And so it goes step by step through the practice, and all through, from scripting to how you answer the phone, to how the office looks, to how you do advertising, and how that is impacted by the mindset of the dentist, the mindset of the team, and then the words you use and the images you use, and basically create a strategy for maximizing that in your practice.
Fantastic. And we've got a couple of things to talk about, but how would we get a copy of this book? Is there a website you have? Where would we find it?
You can get it on Amazon. It's an audio book you can get as well, or you can go to goaskfred.com.
GoAskFred.com.
Which is a website that has all sorts of marketing information on it. It has over 100 videos, like 2 or 3 minute videos answering questions like, how should I think about a website, or what should I do for the yellow pages, or how would print work in my little town, or any of these questions. And there's videos there. It's a blog every month about marketing, and people can ask me questions directly, and I'll answer them personally.
Absolutely. So get on there and take advantage of that as well. Now, you've got some other services too. Not only do you help patients find the dentist and the dentist get new patients and you do all the screening in between, but now you're doing also some other things.
We do internal marketing now. It's a program called Patient Activator. And what it does is it automatically pulls the information out of the practice database and sends newsletters on a quarterly basis. And they're customized to what the practice does. Now, the dentist can write some of the newsletters, or you can just say, I have CEREC and I always want to emphasize that in my practice. So it's based on the marketing premise that you need to tell your customers / patients over and over again what it is you do and why it's good for them. I ask dentists all the time.
Top of mind. And
yeah, top of mind awareness is the game. It's like, so I say to dentists, how many of your patients would you say know everything that this practice offers?
0.
Yeah. If you're lucky, 10%. Wouldn't you like it to be 90? So that's what it's about. It's marketing 101. Tell your patients in various ways over and over again what you do and why it's great for them. Fantastic. So that's Patient Activator.
So you teach us how to do it, and then you help us do it.
And it's done to happen behind the scenes, so you don't really have to do anything. Dentists say, I want to send newsletters out, but they never get it done. They buy a stack of them, they hand them to the staff and say, send these out. They send the first ones out, but not the second round and the third round. They disappear in a storeroom.
They do, you're exactly right. So what else, before we close, would you like to tell us here, Fred, that will help us
Well, the thing I always like to get across is that this profession does an amazing thing for people, and the consumer doesn't realize it. And I think a lot of dentists and staff don't really make this connection that dentistry is a great investment. It's an amazing way to spend $10,000, $15,000 and affect every smile, every kiss, every conversation, every meal for the rest of your life. What could be like that for 10? Where would you get that value anywhere else? So you have to believe that value, and then you have to effectively communicate that value, and I think practices will grow tremendously based on that.
I love it. That's fantastic. How do we get in touch with you? How do we get a hold of you?
The easiest way is even if a dentist wanted to get a hold of us, they just call 1-800-DENTIST and say, put me to the front desk.
I'm a dentist.
Yeah,
okay.
yeah. It's as easy as that.
Dentist or goaskfred.com.
Yep.
Great. Fred, thanks so much for being with us.
My pleasure.
Appreciate it.
Sure.
Great.